In 2018, the UK's Royal College of Physicians published a comprehensive scientific report which concluded that vaping nicotine can eliminate almost all the harm from smoking cigarettes, and recommended promoting the use of e-cigarettes to smokers as widely as possible. The report also indicated that vaping nicotine is at least 95% less harmful than smoking. Public Health England concurs. Even the American Cancer Society is beginning to understand the promise of tobacco harm reduction, stating that e-cigarettes are, quote, likely to be significantly less harmful for adults than smoking regular cigarettes, and they encourage adults who have failed other FDA-approved methods to switch to e-cigarettes.
Thank you, Ms. Porter. I need to correct the record on a couple things that were just said. There is no evidence to suggest that e-cigarettes are safe or even safer than cigarettes. That's why the FDA just released their regulations directed at Juul. Secondly, the CDC just came in and presented evidence that they don't know the cause of the current outbreak and did not rule out nicotine e-cigarettes.
May I respond?
No. We are about to start questioning, and you can respond then.
Okay.
I will recognize myself for 5 minutes.
Ms. Porter, you wanted to respond to some of the other congressmen. I'd like to give you an opportunity to say what you wanted to say.
Well, what I wanted to say was, with regard to the chairman's comments that there's no evidence that e-cigarettes are less harmful, that's just simply not true. It was a comprehensive scientific report that was generated by the United Kingdom's Royal College of Physicians. It wasn't just an opinion. It wasn't anecdotal, as it were. It was actually a scientific report. Also, and I'm not sure how many people had a chance to see this on CBS This Morning last week, Dr. David Abrams from the NYU College of Global Public Health indicated that abundant evidence exists that the cancer biomarkers associated with e-cigarettes are vastly lower than the ones that are associated with smoking. I would also like to ask if somebody could please answer me this particular question. What is the particular mechanism by which PG and VG could possibly cause disease? I recall Dr. Rizzo said something about PG and VG causing disease. What is the particular mechanism that vegetable glycerin or propylene glycol actually could cause disease?
Dr. Rizzo, could you care to respond to the claim that e-cigarettes are safer than combustible cigarettes?
Yes, the quote about the United Kingdom's decision that 95% safer than tobacco. If you read the articles about how that decision was made, a group of experts got together for 2 days in Europe. Several of those experts admitted to be working for the vaping industry, and the European Respiratory Society, the Lancet editorial, and 14 professional societies in this country wrote letters to the United Kingdom saying they don't agree with that public health decision. And also in the United Kingdom, there's a much different aspect of e-cigarettes. They're controlled and regulated much more strictly than this country. The tobacco flavors are not there. So you really can't compare what happens in England to this country, and it really is faulty science that it was based on.
Right, so that was a bogus study, bogus study, bogus study, bogus study. What's the nicotine levels that are allowed